Hello, Anita Valens. How are you doing today?
Doing terrific. And yourself?
I'm living it up.
Yay. My favorite line that you say.
I'm getting ready to go out and play golf.
Oh, well, that's pretty cool. And the reason you can run around and do all your sports is because of the treatments, regenerative in nature, that we're going to talk about during this hour. And we're going to take calls from you, our fabulous listeners, at 1-866-870-5752. And you will call us and talk about your muscle pain, joint pain, tendon pain, ligament pain, anything in the musculoskeletal arena, and common things like arthritis, perhaps stiff joints, dull aches, basically orthopedics. And that's what our topic is today. When you call the show, you get Dr. Darrow's latest book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has over 250 studies, actual research that has been done on these treatments. And please check Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can see Dr. Darrow performing the treatments on video, and you can also email him off of every page on the site. So we are here Saturdays at 10 a.m. and again at 1 p.m. So what do you think of all that?
Well, what you don't know, Anita, is that I've got a video camera looking at me right now and the microphone.
Ooh.
And we're going
I
to
like
be...
it.
Yeah, it's a lot of fun. We're going to be publishing and posting the shows from now on Facebook and Instagram and on YouTube. So we'll give you guys notice of how to do that later, not during this show, but I've got to talk to my, what do we call those guys?
The IT people.
The IT people. Yeah, we'll talk to the IT people and let you know when all of that will be happening. So I do have an email right here that
Great.
Just came in.
All righty.
And I will be able to explain what I do based on this email, I assume. Let's take a peek.
All righty.
And see what it says. This one starts off with the byline is left shoulder. Let's see what this woman says. Okay, I have two partial tears, one in my subscapularis, that's a tendon, and one in the she calls it spinatus, it's supraspinatus, both in my left shoulder. Neither prolotherapy nor PRP treatment has made a difference. I would like to get an idea of how your treatments would be different. The main way my treatments are different than other doctors is that when we inject a shoulder, for example, we're going to hit all of the spots in that shoulder. So there's 4 rotator cuff tendons, and each of them are probably going to get about 6 or 8 injections. There's a joint, there is a subdeltoid bursa, and all of these areas are very important to address. So a person who comes in, if they get their shoulder injected by me, are probably going to get maybe 30 pokes, whereas a typical doctor is going to inject one spot, just like they would if they were doing a steroid injection, which is what most of them are used to doing. And I'm not big into steroids. Anita, you and I both know, and a lot of our listeners know, that the steroid shots, usually called cortisone, actually destroy the tissue.
Right.
It makes it feel good for a while, and then long term it destroys the tissue, and the issue in the tissue gets worse. That's a good one. So my technique is different, and I get a lot of people from all over the world who have had these techniques done and have failed, and they get better when I do them because my technique is more of a comprehensive approach, not just a one poke deal. There are some areas that it just takes one injection, but there are others that take tons of injections to hit all of the areas. So that's the underlying thesis of what I'm doing to regenerate tissue. And if you're smart, you'll call the show right now, and the number here is 866-870-5752. I'll repeat that, 866-870-5752. And if you do call in, you're going to get a copy of my book, which is on stem cell and platelets. It's called Regenerate, Don't Operate, meaning please regenerate the tissue. Don't cut it out, because once you cut out the tissue, whatever area you're trying to heal becomes destabilized. You might get some goodness in the area for a while, but long term it's not a good idea. As an example, if someone goes into the labrum, which is sort of a covering around the humerus bone in the shoulder that fits around it to help hold it in, then if that is cut out, what happens to the integrity of the shoulder? It's compromised. If someone goes into a meniscus in the knee and shaves it down, what happens to that knee? It's compromised. If they go into a hip labrum and take out the tissue, it's compromised. So you might feel better for a while, and then down the road, watch out. It's like winning the battle and then losing the war long term. So we want to regenerate these areas, and what we use are cells from your own body. So we can take your blood, we can spin it in a centrifuge, throw away the red cells that can be caustic to the tissue and make it hurt, and just inject the platelets. Or we can take your bone marrow from the pelvis, which has platelets and it has stem cells in it, and inject that. The newer treatments now are using platelets plus umbilical cord cells, and there's controversy about that with the FDA. I want you to know that ahead of time. The FDA has a moratorium where they're not going to block people from doing these treatments until 2020 in November, supposedly. And there's been a little change in the FDA. Scott Gottlieb, who was the director, just left. And we don't know what's going to be happening yet. But I will keep you up to date as I find out. And we'll see where these stem cell procedures fit in with FDA guidelines. Right now it's kind of open season and we can kind of do what we want. There's been a lot of literature and writing in the Wall Street Journal, New York papers and all that about stem cells causing blindness and that they shouldn't be used on disease states. And I don't do that. I don't do them IV. I do them only for orthopedics, which so far the FDA has allowed to take place. If anyone wants more information on that, they can go to my website at www.lastemcells.com, and I will shoot you back an email on what's going on with all of that with the FDA. And yes, Nita, I hear you breathing. That means you want to talk.
Yes, I breathed. Just once in a while I like to breathe. I just wanted to let you know that we have a couple people on hold, and I think we should go talk to Louis in Santa Ana. What do you think?
Yeah, I'd love it. Louis, Dr. Marc Darrow, I understand that your shoulder blade is overlapping. The doctor said it requires a surgery. So when you say shoulder blade, you're talking about the scapula in your back. Is that true?
Well, I really don't know. It's on the side of the shoulder where I guess the tendon attaches, and I have those type of bones that overlap. And the way he explained it is eventually the bone will sever the tendon, and you'll need another surgery.
I'm not really getting enough information specifically. Did he say it's a rotator cuff tear? Did he say it's a nerve problem? What did he tell you?
Well, it started with the left shoulder. I ripped the tendon off. They had to do a surgery. So when he went in, they had to reattach the tendon, and then he said he had to file the shoulder blade that was overlapping. And he says the other side, eventually, because you have those type of bones would sever that tendon.
I think I got it. Here's what I think we're talking about. There is a part of the shoulder coming off of the shoulder blade that's called the acromion. It's the top part, okay? And you can look that up on Google. Look up acromion. Starts with an A. And some people have what we call an overriding acromion, where it's beaked a little bit, and it goes into the tendon a bit. Now, in my experience, in over 20 years or more in doing these things, I don't find that is important. That's just me personally. I'm not here to fight the traditional medical system, but in essence, that's what happens with the new medicines that we do with regenerative medicine. I had a shoulder surgery when I was in medical school, and God bless my boss who was teaching me orthopedic surgery. He shaved off that bone, just like you had done, and my shoulder got much, much worse. Okay?
Really?
And so I don't prescribe that for anybody. Many people have that overriding acromion and don't have any problem at all. So visually you would think it's a problem, but practically I don't think it is. And
the only time...
let me finish up.
Go ahead.
So the good news was I suffered for a couple of years. My shoulder was blown up like a balloon. My arm was swollen. And I then found regenerative medicine. I injected my own shoulder one time. I woke up the next morning and my shoulder was completely healed, and I went back to sports. And this shoulder is working very, very well today. So I want to caution people about getting surgery. Sometimes it is an emergency and you have to do it. But if it's elective, that means you get to decide. You get to elect whether or not you should do it. And that's not a surgery that I like.
Right, that's why I'm calling you.
Yeah, having had it done to me and having the failure, I promise you it's not a surgery that I like. Any other questions about that? I think we can help. I think we can help you with your own platelets or stem cells in healing up the problems that you're having.
Great.
And I won't know a thing until I examine you.
Right. No, you'll hear from me. Eventually you will hear from me.
And just so I'm giving a sort of a disclaimer on the show, just because I'm giving out information doesn't mean that I'm your doctor. You got to come in for me to be your doctor and give you real advice. You got to come in, let me touch the body and get your history, and that's how you become a patient.
Great.
And the phone number to the office, by the way, is 800-300-9300. That's 800-300-9300. And for those of you that, for those of you that want to find out if we take your insurance, you can call in right now to that number, 800-300-9300, and we'll do an insurance verification. We do take Medicare and Blue Cross, Cigna, Aetna, United Healthcare, Blue Shield, all of those. But the insurance industry is so crazy right now that there's so many types of insurance. Even though we take the name of that, you may not be covered. So you just call into that number, 800-300-9300. We do have people waiting on the phones, and they will tell you whether your insurance covers what I do. Now, the problem is, if we take your insurance, it'll get you in the door for a visit, but it doesn't typically pay for regenerative procedures, so you need to call in and find out. We also take Care Credit, which is like insurance in that it's a credit card. It won't pay for the visit, but it pays for the visit only in terms of upfront, like a credit card would. And then it gives you a year to go ahead and pay that off. Now hit me up with more questions, Louis. What else?
That's it. You've answered all my questions.
All right. Well, God bless you, and you have a great day, and know that there's great hope in healing up your shoulders.
Great. Thanks a lot.
Thanks, Louis, for your call. We appreciate it.
Thank you.
Our number is 866-870-5752, and we're going to go to Steve.
Steve, Dr. Marc Darrow, I understand that you want to know if there's surgical alternatives for a hernia, yes?
Yes, that's my question.
Okay. Is it an inguinal hernia in the groin?
Yes.
Okay. So way back in the late 1800s, there was a surgeon in France whose last name was Perret, and he used these techniques to cauterize hernias. It's before surgery was real big in that field, and surgery was super dangerous because of the infections. So he would inject the area. The problem with that today is it's not as good as the surgery. So it's not something that I do, and I'm going to refer you, if you go to my website and you email me, I can refer you to some of the best hernia surgeons in town. And the website is www.lastemcells.com, lastemcells.com. And if you'd like to go to that website, every page has a spot where you can email me. And I will get right back to you about that, okay?
Thank you very much.
Yeah, that's not an orthopedic question. And that's basically what I handle.
Thank you very much, Steve, for your call. We appreciate it. Our number is 866-870-5752. That's 866-870-5752. You're listening to Living Pain Free with Dr. Marc Darrow, and the pain we focus on is musculoskeletal in nature. That's arthritis pain, joint pain, muscle pain, knee pain, elbow pain, things of that nature. And so what we're going to do right now is give you a moment, if you like, Dr. Darrow, to talk about a couple other things going on in your office, like
Sure.
Ideal Protein.
Yeah, Ideal Protein is a diet that I use, and please don't kill the messenger. That's me. Yeah, I apologize before I talk about it, but if you've got lower extremity pain, hips and knees and legs and ankles and toes, arthritis, whatever that is, you're going to have to lose weight if you're overweight to really get the best effect from my treatments. So I do talk about it. The diet that I like the best is called Ideal Protein. It puts people into ketosis. That's a very trendy word today. It's a keto diet. And I did it myself to experiment to see if it was a diet I wanted to use. One of my friends who's a doc was using it in his practice with great success. And skinny old me lost 7 pounds in 1 week. So it works amazingly well.
That's amazing.
I was about 170 and lost 7 pounds in 1 week. So it's an amazing, amazing diet. Please don't get mad at me when I mention diet. A lot of people get angry and they go, I didn't come here for a diet. Well, you came here to heal the joint, and unfortunately that's part of the package. I can only do so much. I had a woman come in yesterday who was overweight, and I said, I can do 25% of the work. You're going to have to do 75% of it. She was very overweight. And I didn't want to lie to her. I didn't want to say, don't worry about it. Let me just start taking your money and doing injections, and don't worry about anything. You've got to pitch in. Most people, it's not as important, but this woman was massively overweight. And we know that obesity causes arthritis. So you may as well start losing weight before you come in to see me. An easy way to do it without this diet is just doing low carbohydrates, eating protein, vegetables, fat. Yes, the more fat you eat, the skinnier you get because it keeps your insulin low. When your insulin is low, you eat your own fat. So eating fat's a good thing. And water. Stay away from juice and sugary things. Stay away from grain. That's the worst. Dairy products, fruit. Yep, fruit. High fructose. And sugar, obviously, desserts, and alcohol. And you're in business to lose weight quick. The other thing in the office, which my gorgeous wife, Michelle Darrow, does, and she does it on her own face, is called the Vampire Facelift. So it's taking the same thing that I do, cells from your body, the platelets, and injecting them into the face to regrow the collagen in the face and make you young again. And everybody loves that.
Oh, of course. We're the culture of eternal youth, aren't we?
Well, I think that goes back to the caveman days. Everybody's always wanted to stay young. No one likes to get old or think about leaving this planet.
Well, you know what Betty Davis said about aging? Getting older ain't for sissies.
That's right.
So our number is 866-870-5752. That's 866-870-5752. We're taking your calls all hour about your musculoskeletal pain. We are here Saturdays at 10 a.m. and again at 1 p.m. And Dr. Darrow's website is www.lastemcells.com. That's lastemcells.com. And you want to go there and see Dr. Darrow performing the treatments on video, and you also can email him off of every page on the site. And the office number is 800-300-9300, 800-300-9300. So I bet you have another email lurking.
I have endless emails from you guys, and I appreciate them. And again, I'll just mention this to email me. All you have to do is go to my website, www.lastemcells.com. Every page has a spot to email me. There's spots there where you can get a copy of my wonderful new book about stem cells and platelet therapy, how to regenerate the tissue instead of operate and cut it out. And this one is an interesting topic. And we don't get as many of these as, let's say, knees or hips or shoulders or other parts of the body. But I do inject the whole body because people have ailments all over the place. This one says TMD, and that means temporomandibular joint dysfunction, that joint that we chew with. And a lot of people get that. And I've been doing that joint for over 20 years with, from what I know of, absolute complete success. And the nice thing about injecting that area is we can use a 30-gauge needle. It's the size of an acupuncture needle. And we just pepper it around the joint and around the disc that's in there. And we've healed those up. So let me see what this person says. I have really bad TMD pain with osteoarthritis. I work as a speech therapist. I'm worried about whether I will be able to continue my field if the pain gets worse. Are there any options for someone like me? Yeah. We would probably start you out, depending how severe the arthritis is, with platelets from your blood. Simple procedure. We draw your blood from your arm. We spin it in a centrifuge, and then we throw away the red cells and use the platelets. And if it was very severe arthritis, we'd probably want to use your bone marrow to get stem cells and platelets. Or for those of you that are into it, we would use your PRP, your platelets, plus cord blood stem cells. And the book that I have written was before the cord blood was being used. And I have a new chapter to go into the book. So if you email me at the website at www.lastemcells.com and ask for a copy of the book and a copy of the new chapter that's not into this book yet, I will send them both out to you. So yes, Miss Speech Therapist, that's great work you're doing. I thank you for that. And, a lot of the speech therapists work with people that have had strokes and brain trauma, and they do a great job in getting these people back to speaking again.
Oh, guess what?
Yay,
It is
my favorite instrument, the banjo.
Yay. Well, it is halfway through our show. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and please grab a pen or a pencil, write down this important information about to come your way, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.